Hi, I'm Dr. Sanjay Azad, the plastic surgeon at Thunder Bay in Ontario, Canada. This series called Surgery Basics is for educational purposes. I wish to thank Nicholas Nucci and Miranda War, who have been instrumental in creating this series. This video is about the blanket suture or continuous suture. Essentially, what you do is you take an interrupted bite as the interrupted suture video. So you're passing the needle through and then you're taking anchorage here. Don't hold the swedge or the tip of the needle, and make sure you get the stitch drawn through. And then what you're doing is doing a 2-1-2 start. So 2 throws and hold this shorter end and then take it across. And this is your fine adjustment to one side of the wound. And then you do 1 reverse, and then you do again 2 forward. So what happens is there is a 2-1-2 sort of start up, and this anchors it. And now the short end of this stitch you got to cut shorter. So the short end short, the long one is kept long. This is typically used in linear wounds, longer wounds. It can also be used in slightly irregular wounds, especially when speed is required and there is no major cosmetic consideration. So now what we're going to do is basically take bites through these areas and then run it all the way. So it provides you with good speed. Just space the bites out. The technique is super important here. Don't sort of run it too close to each suture, and then you can see this is going to bring the edges together quite nicely and keep things together. So very quick and effective way of sewing up a longer wound. The advantage of the interrupted suture in comparison to this would be that there is a better distribution of tension. So the interrupted suture provides you with a better cosmetic outcome in that sense. But in some patients, particularly patients with a lot of laxity of skin, what we find is that it doesn't make that much of a difference with the use of continuous or interrupted suture. So I'm coming to the end of my continuous suture here. It's well spaced started. You can see the skin edges are drawn together quite nicely, and then I need to finish up the suture. So here what we're going to do is we're going to sew this to the loop. This is again a very useful technique to do when you're finishing up any kind of long suture. So you've got a loop sitting out here, and I'm going to do a 2-1-2 to the loop. So I'm going to take 2 bites, 2 throws of this, then hold the loop and then bring it down and bed it down. You can see again it's tying everything together, and then I'm going to reverse it and then bring it across. So that's the one, and then I'm going to take another 2 throws and hold it, and then finally done. So that's gives me security at the end of my suture, and then we can cut it to about 6 to 7 millimeters length, and it's done. So that's a continuous or blanket suture. Thank you for watching this video. In this series we have a lot of other videos to help you in improving your surgical skills.